All right, and we're back. And so in this video, we're going to talk specifically about the tibiofemoral joint, or that knee joint. The things that are on your structure list that you need to know are going to be the quadriceps femoris tendon. You're going to need to know the patella, the patellar tendon, the ACL, or anterior cruciate ligament, the PCL, or the posterior cruciate ligament. You need to know the tibial collateral ligament and the fibular collateral ligament. Collateral, co means same or with, and then lateral is talking about lateral. And we'll get more into that when we get to those ligaments. But they're telling you that this ligament is going on the same side, all right, versus ipsilateral, or which is going to be like a cross. And then we have our meniscus, your lateral and medial meniscus, and your patellar ligament. So looking at this, you click on your skeletal module. That's where we are. You go down here to the knee joint, and you click on the knee joint. Select your view. We want to look anterior, and so here you can see somebody's knee. Here's where the femoris muscle will be. Here's where the kneecap or the patella is, and then down here is where the tibia is. You can kind of see that tibial tuberosity where the patellar ligament inserts. But then we can skin this knee. So we can pull the skin off. Now you can see the tendon sheath for that rectus femoris tendon coming down to the patella, and then the patellar tendon coming down to the tibial tuberosity. Your patella is a sesamoid bone, so it does form in this quadriceps tendon that inserts down here. We can remove that. So now the tendons are gone. You can see the patella with the base and the apex here. You can see the articular regions for the femur. You can see the menisci on the joint, so these pads in between the tibia and the femur. You can also see those collateral ligaments. So this one is coming all the way down here to the fibula. Your fibula is going to be lateral, and so this will be your lateral meniscus. This is the medial meniscus, and this is your tibular ligament. Remove this layer. You can see it even better. Now the patella is gone. You can see the femur. Again, tibia collateral, fibular collateral, the menisci. Go down one more layer, and now you can see the ACL, the anterior cruciate ligament, and the PCL back here behind, because it's posterior, right? Posterior cruciate ligament. We can turn this around, so we can look at it posterior. So here's the popliteal region of the leg. Remove that. You can kind of see parts of the joint capsule here. You can see that fibular collateral ligament right there. Even better now. Here you can see the tibial, again, the articular part of the femur. Coming down again. You can see a bit of the ACL right there, a bit of the PCL right there. Again, those menisci pads, lateral, medial, tibiocollateral. And if ever you're like, man, I don't know where any of this stuff is, you can always click up here and it will show you the tags for this stuff. So here you can see the fibular collateral ligament, the lateral meniscus. You also get some stuff that we don't have on our structure list, like the posterior menisci-cofemoral ligament. Not one you need to know, but you do need to know the ACL. Here's your PCL, the medial meniscus, the tibial collateral, and sometimes you'll see these little triangles. These are for different groups. So the green ones are for the skeletal module. A lot of these are dealing with, that's some nervous, so your tibial nerve. Here's a popliteal artery, your popliteal vein. Down here is your soleus muscle, the tendon in the biceps femoris. And so we're getting some muscles, arteries, veins, nerves in here with this stuff. But the green ones are the ones dealing with the skeletal system. So here you can see the arcuate popliteal ligament. There's your fibular collateral ligament. Here's a bit of that capsule of the knee joint, opaque popliteal ligament. And so you can always click on these to show you stuff. Very simple. This is the projection of the knee cavity joint, the popliteal region. See, your femur, the articular surface, the lateral condyle, intercondylar fossa, and all these. So, play with the tags if you're having a hard time finding what you're looking for, or just to double check yourself. And again, always come up here and take these quizzes to help you work through the stuff, okay? So we can do axial skeleton, appendicular, or the joints. Since we're doing joints today, you can click to identify, multiple choice, lab practical, or any combination, and then you just start moving through there. We haven't talked about the radial tuberosity yet, but that's going to be this little part right here, right? All right, so that's it for the knee joint. The next one is going to be movements, and I will see you then.